Hello, my Vetfolio voice friends. We're so happy you're joining us for this podcast, sponsored in part by DECRA. In this episode, I'm joined by Dr. Cynthia Otto, and we'll be discussing one of my favorite topics, canine osteoarthritis and the role of weight and nutraceuticals in managing this condition. For anyone not familiar with Dr. Otto, she's a tenured professor of working dog sciences and sports medicine at the University of Pennsylvania, where she previously served as an attending clinician in the emergency service. Following deployment with the Pennsylvania Task Force to 9/11, she initiated a study of search dogs that worked during 9/11. She created and serves as the executive director of the Penn Vet Working Dog Center. She's published over 60 peer-reviewed articles, numerous book chapters, and is an internationally recognized speaker in both emergency medicine and working dog medicine. She was named Pennsylvania's 2002 Veterinarian of the Year and has received numerous awards for her work. We also had a good laugh about how despite her being in Pennsylvania and me being in Florida, I was the one who found myself without water due to frozen pipes on the morning we recorded this. I really hope you enjoy this episode. Let's jump in. All right, Dr. Otto, thank you so much for being here with us today.
Oh, Cassie, it's my pleasure.
We're here to talk about arthritis, and I want to start out just super basic. We talk about arthritis all the time as far as how to manage it, the different medical and surgical options. But in case we have listeners who maybe are new to the field, or just as a refresher for all of us, let's talk about the actual definition of arthritis. What is it, and why does it happen?
I think that's a great place to start because I think there's a lot of confusion. And especially when we dive into the literature, there's a lot of different terms that are thrown around. And we talk about osteoarthritis predominantly in our dogs. But if you look at the human literature, they spend a lot of time talking about rheumatoid arthritis, which is very different and not that common in dogs. And so when we're thinking about arthritis, we really need to think about osteoarthritis. And what does that mean? Well, arthritis itself is inflammation of the joint. And so what is inflammation? We can go back to those cardinal signs of inflammation, no matter where it is. And that would be heat, redness, swelling, pain, and loss of function. So what causes all of that? And I think we also have to be really careful thinking about, is inflammation always bad? If it's so horrible, why does it actually happen? And inflammation is just the body's response to an insult. Usually we think about it as an insult to like an infection. So an abscess is my classic example of inflammation. You get red hot, swollen, painful, and you can't move that area. But the same thing can happen in joints. And so that can happen from an infection, but more often, especially when we're talking about arthritis and aging and arthritis and overuse, it happens because there's a breakdown of the normal tissues. And they actually release some of their sort of inner contents, and that triggers more inflammation. So the white blood cells that are kind of patrolling and looking out for things that might cause damage or what they need to clean up get activated, and then they release these mediators, so lots of different proteins and lipids that cause more inflammation. And in a limited amount, inflammation is good because it can remove damaged tissue and allow for healing. But in our joints, we know that it really is challenging for those joints to heal once that starts. And cartilage in particular, because it doesn't have a good blood supply, there's no direct blood supply, it really does have a lot of challenge in recovering from this kind of an insult.
Man, you're taking me back to vet school here with the blood supply and cartilage. And it's all coming back to me as the blood supply shows up. And I'm not even going to attempt to explain it because I'll do a terrible job. I think that's a great way to think about it. Is there this breakdown of normal tissue, and then we don't have great healing abilities in that area. So then we end up with this continual breakdown and progression of arthritis. Are there specific patients who are at higher risk for developing arthritis? What are some of the risk factors we should be looking for?
Well, I think there are definitely risk factors, and I think it's true in humans as well. And so obviously age is one of those risk factors. And I think there are a number of things that actually complicate age and the development of arthritis. And those things that complicate it are, as we get older, we have a tendency to gain more weight. And we know that obesity is absolutely a huge risk factor. And I think thinking about obesity, it's not just that we're carrying more weight and putting more stress on our joints. We know that the fat cells, the adipocytes, actually have a lot of ability to communicate information and create these inflammatory mediators. So they are very active. They're not just sort of passive baggage, but they actually contribute to that inflammatory state that not only affects arthritis, but can affect all sorts of different systems. But certainly arthritis is one of the big ones. In age, we also tend to have less mobility. And so as we get older, we tend to move around less. And that augments our problems. We think, well, we don't want to move around so much and we're not going to have as much wear and tear on our joints. But because that cartilage really relies on movement of joints to pump the nutrients to it, it really is mobility that is critical. And once we start to lose mobility, we lose strength, we lose the muscle mass that's going to support our joints. And then we may get more laxity in our joints because we don't have that muscular support. So those are all pieces of it. And then certainly in our dogs that are very active and have repetitive use. So doing the same thing over and over again. And my dog used to play in agility and fly ball, and there's a lot of repetitive jumping. And that probably contributes to the onset of arthritis. We also know that larger dogs are more prone to arthritis than smaller dogs, but we do know small dogs and cats all can have arthritis and really suffer from it. There may be a genetic component. So dogs that have hip dysplasia or elbow dysplasia are definitely going to have earlier onset, more severe arthritis than dogs that don't have those kind of abnormalities.
Sure. I think you're giving us a lot to think about here. I know I wasn't really thinking about the adipocytes that come with weight gain contributing to the inflammation associated with arthritis, but that makes a lot of sense. And then, of course, there's always the question of when do we rest versus when do we make sure that the mobility is continuing? It sounds like there's not a black and white answer of these patients you rest and these patients you get them up and moving. It's the type of movement involved for that patient.
Kathy, that's absolutely true. And we know that, some of the movement maybe will be beneficial, will be non-weight bearing movement like swimming. That can be something for these older dogs or dogs that are having issues with arthritis, though they're not putting as much weight on it, but they're still getting that movement and they're building the strength because, again, we need that muscular strength. When we talk about the obesity issue, I always love to refer to the study that was done, the longitudinal study. It was done with Labradors at Purina, where they fed them to a body condition score of 5 versus a body condition score of 7 out of 9. And a lot of our pet dogs are hovering around 7s or more. And we forget that these dogs should not look like a sausage. They should actually have a waist, and they should not carry this extra weight. And what happened in that study, and I think it's so impressive, and to share with our clients and even just remind ourselves that dogs that were the 7 out of 9 compared to the 5 out of 9 had 2 years shaved off their lives.
Oh my
and
gosh.
most of that was about mobility and arthritis development. And so really, really important when we're talking about quality of life and how much we love our animals and how, what would we do to keep them with us for another 2 years? Well, we're gonna do all sorts of things. We want those magic drugs and all that, but one of the most valuable things we're going to do is feed them less.
2 years. My goodness, that's a huge impact of body condition. I love arthritis and I love learning about arthritis. And, when I talk to clients, I think I have a pretty good repertoire, but you're giving me so many things just to think about and think about with my own pets. And then also in in talking with clients that maybe are not at the forefront of our mind when we're dealing with arthritis. And, we're reaching for, okay, how do we manage the pain? And let's talk about movement and stuff like that. But 2 years based on body condition, oh my goodness.
Yeah, super, super important.
Yes. So, of course, we're talking about arthritis is inflammation of the joint. So the use of anti-inflammatories would absolutely make sense. But of course, anti-inflammatories, they often don't cut it alone in the long term. So can you tell us a little bit about what kind of supplements might be beneficial in the management of arthritis?
So I think there's a really interesting line that we need to draw between anti-inflammatories and supplements. They're not mutually exclusive because many of our supplements are actually anti-inflammatories. So if we step back and think about our pharmaceutical anti-inflammatories, we think about things like steroids, which are very potent anti-inflammatories, but have tons of side effects, and we definitely don't want to be using those long term. And then we think about our non-steroid anti-inflammatories, and they're really part of our go-to. But we, again, like to minimize the use of those to limit side effects. But if we go back in history, did you know that aspirin is derived from willow bark?
I did not know that.
Salicylic acid is basically kind of one of our first nutraceuticals. And so we have to be careful about saying, oh, it's a pharmaceutical, so it's bad, versus it's a nutraceutical, it's natural, because a lot of these things that we use currently as medications originated as something from nature, and a lot of things that come from nature are actually quite toxic and dangerous. So we really want to think about what it is that we're looking at and take advantage of some of these natural sources of anti-inflammatories. But many of these supplements that do work as anti-inflammatories work on some of the same pathways that our non-steroidals do. Now, our goal is that they should have hopefully fewer side effects, and that we can tolerate them better. And it might be that we're mixing and matching different anti-inflammatory supplements so that we can kind of target the specific pathways that we're interested in. But they really do have a lot of overlap. And so I think that we have to realize that the omega-3 fatty acids, which are probably one of my very favorite sort of general anti-inflammatory type of nutraceutical, is actually changing those eicosanoids, because it's changing, the fats that are incorporated into the cells, and those fats are the ones that drive whether there are eicosanoids produced or not. And so the omega-3s are definitely one of those, but we have all sorts of other supplements that target the COX-2 enzymes, which are the ones that we really think about in the eicosanoid production, like the phycocyanins, ASU. Curcumin may indirectly target the COX-2, but probably more of the lipoxygenase pathways. So there's lots of these anti-inflammatories or anti-inflammatory supplements. Like Boswellia is a lipoxygenase, it targets that. And some of them target the transcription factors, like MSM is something that's going to affect NF-kappa B, which is one of the transcription factors that's important in generating some of these inflammatory mediators. So lots of different ways that we can approach it, and trying to figure out, well, how do we do this in a way that's effective and safe. And again, most of these supplements do seem to have a pretty good safety profile. So that's definitely something to be thinking about.
The multimodal therapy when it comes to arthritis. And I love that you bring up the omega-3 fatty acids, because I put everybody on omega-3 fatty. I'm like, Oprah, you get fatty acids, because I feel like they do such a good job, and they're so important with a lot of inflammatory conditions. But I've noticed a huge difference in my own dogs adding fish oil to their diet.
Oh yeah, and fish oil, I'm on it.
Yeah,
I'm a regular.
Everybody gets fatty acids.
Yeah, and all of the dogs at the Working Dog Center do get supplemented as a prophylactic, as a preventative.
Yes.
Is that helpful or not? It makes sense that we want to, we put these dogs under physical stress and environmental stress. We want to kind of put them in a better ratio of omega-3 to omega-6. What we don't want to do is we don't want to just have omega-3s because then the normal role of inflammation has the potential to be hampered. And so that would be a concern. A lot of our anti-inflammatory medication has the potential to alter coagulation. Probably not at the doses that we're approaching, but I did read one case report about a dog that ate 200 of the chewable supplements and ended up developing liver failure and dying. It's pretty rare and unusual. It's unknown of the mechanism, but certainly anything that we overdo, and some of these supplements are very tasty. And so, dogs may be inclined to consume all of them if they get access. And we have to realize that it is a balance. And so some is good, more is not always better.
Sure. Or you could be like me and have a Labrador, and it doesn't matter if they're tasty. They just want to eat whatever they can get their little mouths on.
Of course, the labs are notorious.
Yes. So I can, as far as the omega fatty acids and Boswellia in particular, MSM, I know I've seen those particular supplements help in my own dog. So I definitely believe in their efficacy. But what kind of evidence is out there to support the use of these types of supplements in arthritis patients?
So, Cassie, this is what has tormented me for about the last 3 months since we started talking about having this podcast. And so I started really trying to dig in because it's like there's so much information out there and it's so contradictory or difficult to interpret. And so I looked at the human literature. I've listened to 3 or 4 lectures by boarded specialists in sports medicine or nutrition and human specialists, and everybody tells you something different. So there's just a lot of information out there that is really hard to kind of put our finger on what are the effects? And a lot of it depends on if we're looking at how they evaluate it. There are some things that our recommendations are made because we know the mechanism that this supplement works on. And that would be, it is able to block COX-2 or LOX or, enhance some of those other aspects that are beneficial. But maybe that's based on in vitro studies, or maybe it's based on experimental animal studies. And then we have to look at what species. Was it done in rats or was it done in dogs? And then there are the clinical trials. And when we're talking about clinical trials in veterinary medicine, we're lucky to get like 15 or 20 dogs, in a trial. Whereas in human medicine, they usually are talking about thousands of people. So when you look at the human literature, there's still a lot of debate about the efficacy of things like glucosamine, chondroitin sulfate. So a lot of knee arthritis papers and studies have been written, and one of the recent meta-analyses, it was inconclusive. But the question is that because it was just glucosamine and chondroitin, or is that because they had a select population, or were those is glucosamine and chondroitin better as a preventative as opposed to a treatment? There's a lot of questions that we don't know. And I think that sometimes we just have to go with our experience. We also know that there's certainly a lot of placebo effect, but we've kind of balanced what we understand about the mechanism, what we understand about the safety, and then we look for a number of things about the supplements. One, are they what they say they are? So we really want to rely on something like the the NACS quality seal, which is going to give us at least an outside assessment for quality control and labeling guidelines. Documenting that the quality is indeed as it should be. So that's something that we want to be thinking about. I think that we have to decide, is this something worth trying? And what am I using it for? And how do I know if it's actually benefiting? So again, we use fish oils as a preventative in all of our dogs that are athletes, because we feel like that's got some benefits. If we have a dog that actually has a risk factor, like hip laxity, which maybe hasn't already progressed to arthritis, but has the risk for arthritis, we're going to put those dogs on particularly a lot of these combination supplements, because we hope it might work, but we don't really have a lot of good, strong evidence. And so we have to weigh the cost of it, the potential benefit, and any risk. And the risks are probably pretty low.
Sure. So it certainly can't hurt in some of these high risk patients, which I love that you bring up the idea of using them as preventatives, because that was actually my next question, is as far as using them as preventatives, does that make sense to do that in our high risk patients? I know you kind of mentioned maybe glucosamine chondroitin is better as a preventative. We don't know. What, and you said you use the fish oils in the working dogs as a preventative, because we're not hurting anything and we may be providing some benefit. What are your recommendations for our high-risk arthritis patients and using supplements?
So I think supplements are part of a multimodal approach. I don't think that your supplements are going to be the full answer. I think probably our strongest evidence is weight control. And then I think that the other thing we know is that arthritis is probably better prevented than treated, because once you've got the damage, it's really hard to resolve it. So anything that we can do that can enhance joint health is probably a good investment. Again, there's just not a lot of evidence, and it's a hard one to study, because how are you going to study something that doesn't happen? So you really want to look at the dogs, and if we had this double-blind placebo-controlled trial, we would have to have all of these dogs that had similar risk factors, similar activity, and then ideally the ones on supplements would have a slower onset of arthritis, or maybe no arthritis. And that would be a lifetime study that we would actually have to be evaluating that. And so that I think is really challenging. And again, understanding the physiology of it, and understanding the quality of the products that we're choosing to use, and knowing that these products can actually reach therapeutic levels. Those are all pieces that then give me more confidence to say that this is something that I'm going to do. I wish I had really hard data documenting that this was the way to go, but I think again the risk is low, and the potential benefit is there.
That absolutely makes sense, and that's always been my feeling as well, is if we're not hurting anything and we have these high risk patients, and our risk is pretty low, then, especially my own dogs, is it going to hurt anything to go ahead and provide these supplements? It sounds like what encompasses so much of medicine, and what we talked about earlier, that there's not a black and white answer. It's an individual patient and their risk factors and their lifestyle, taking all of that into account and then making the best decision for them.
Right. And I think that's part of practice of medicine. It isn't hard and fast. And the other thing is that there may be certain populations that respond and others that don't. And so we try it, on the preventive side, it's hard to know if it's not working, if it's not benefiting. If we're using it therapeutically to manage the pain associated, then that gives us a little bit more clear outcome. We can use some of the tools for pain assessment. We can use some objective, gait analysis and things like that, to really see. And I've had that experience as well with some dogs that I've put on some of these supplements, and like, whoa, that just made a huge difference in that dog's mobility and quality of life. And again, when we lose mobility in our dogs, it just really becomes a downhill spiral on that, because they stop moving, they're less comfortable, they lose muscle mass, they are less comfortable, they stop moving. So anything that we can do to keep that mobility. Loss of mobility is one of the main causes for euthanasia as dogs age, because they can't get up and get around anymore. And so this is a huge issue, and anything that we can do to keep them moving and comfortable, I think is certainly worth it.
Absolutely. We run into major quality of life issues when we start to lose mobility. So we've talked about weight control and supplements, anti-inflammatories. What other considerations should we keep in mind for our patients or our own pets that have been diagnosed with arthritis?
Well, I think that weight control, again, number one, there's just no question in my mind that's absolute. Maintaining activity, and basically really thinking about sports medicine, physical fitness, some level, it may not be sort of classic rehabilitation. It might just be strength building and making sure that is part of the plan, so that, a dog can be a body condition score of a 5 out of 9 or even a 4 out of 9, but not have the muscle strength. So we want to make sure that we're kind of paying attention to their physical fitness. But there are other tools and modalities that we can use, especially if there's pain involved, because it's hard to do any kind of fitness if we have pain. So whenever we're thinking about that, our first goal is pain management. And, the nonsteroidals may be an option, definitely the supplements, but things like acupuncture and chiropractic, massage, all of those things can be really great as additions to what else that we're doing. And certainly we can go down the very extreme end and think about surgery. So for hip dysplasia, we may do a hip replacement, but that usually isn't our first line. I think there's a lot of other things that we can do to maintain, function and comfort and mobility in these dogs.
Yeah, this is one of my favorite things about managing arthritis is I feel like there's a lot of options and a lot of different things to try. And, ideally, then you get to see a really great quality of life improvement in that patient.
Oh, yeah. It's so amazing. We had a patient come in. There was a service dog, and he was a Labrador and probably 20 pounds overweight. So he weighed 104 when he came in, and not mobile. Just everything kind of hurt, and he had a little bit of elbow dysplasia. We went through a weight loss and fitness program, and that dog turned around and just found the joy of life again. And that was, of course, we added, supplements with all of that approach. And we're using the nonsteroidals kind of as needed, but as we continue to lose weight and gain strength, we were able to back off and not use nonsteroidals regularly, and sticking with that supplements and the rest of the plan was really life-changing for that dog.
That's awesome. It's so rewarding. Well, Dr. Otto, I have learned so much from our talk today and really, truly enjoyed it. Are there any final thoughts you'd like to share with us before we go?
Keep active. Love your dog. Enjoy life. It's so great that we actually have so many options of, trying the different approaches. And again, there's not a magic formula. So try different things. If it doesn't seem to improve, there's lots of other combinations. And ideally we'll keep chipping away at the science and hopefully get some stronger evidence for it.
Yes, that's great advice. And I'm looking forward to all the further research about arthritis and being able to make those improvements for our patients. Thank you so much for being with us today. Like I said, I really, truly enjoyed our talk.
It was great talking with you, Cassie.
Thank you again, Dr. Otto, and thank you, listeners, for joining us. And thank you to DECRA for sponsoring this event. If you'd like to find out more about this or other exciting podcasts, click on the Education tab on the Vetfolio website. As always, we'd love to hear your input on this session, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.